Hi, it's Dr. Micahel Winters, and I want to talk with you today about fixing the lower back. Imagine if everything you do, muscles on one side of your spine are working strongly, and on the other side of the spine they're not firing like they should, and they're just not nearly as strong. That's going to create some chronic problems, and that's what we're seeing with a lot of people. And I want to introduce you today to a great new technique we have called Cranial Low Force Technique. It literally, in 32 years of practice, this is a total game changer. It really is. We've had some amazing results with it already. Yesterday I adjusted a patient. She could barely open her jaw and it went crooked, and then I adjusted her with this low force technique and her jaw opened smoothly. We've seen some great responses on other muscles and hip muscles and knee muscles, and people walking out of the office with virtually no pain when they came in with a lot of pain. So I want to show you today about how we fix the lower back. So I'm going to demonstrate a couple muscles here on Karen to show you the difference. Then I'll show you the correction, and then I'll show you how it is afterwards. So we're going to look at just a couple of her lower back muscles. So Karen, cross your arms over, bend to the side here. I'm going to try to push her back up, and she's strong. Now bend to this side. And I'm going to try to push her back up, and she's obviously very weak. So Karen, go ahead and lay on your back here for me. Now we're testing the small muscles along your spine here. And we're going to come over here like this. With this first one, we're going to turn this foot out. And I'm going to try to bring her legs back. If she's strong, she'll be able to keep her legs solid. And she's weak. And I've already picked out which muscles were weak here so I can demonstrate for you. And she's weak. But if I do it, for example, on this side, same test as the 2 tests ago, she's solid as can be. She's strong. So we're going to turn on those muscles that are weak and help them work correctly so that when she's doing her everyday activities, her back can stay strong. So Karen, go ahead and sit up here on the edge of the bed, edge of the table for me. Scoot over just a little bit, if you can still see it okay in the video. I'm going to come in here on her cranial area, right in the back of the skull where some of the muscles attach, and those are muscles attached to the dura, which is the covering that's continuous around the brain and continuous around the spinal cord. It's a very gentle correction. You barely even feel it being done, but it's just amazing here. Now I'm going to get a little bit of a line of drive here because I didn't get that ahead of time. Okay, so I know which direction I need to go here. And we're going to come in here very gently. I'm just letting that dura, that covering, release, and I kind of feel it under my hands. We either go up or down with it first. And then when we feel that go, we go in a rotational direction. Okay, so we made the correction. Now we're going to check her. Can you still see okay on the camera? Okay, let's cross here. This is the direction she was weak in, so bend toward me. And hold. And she's solid as can be. Now, let's have you lay on your back here. We're going to test the same muscles, some different muscles, the small ones along the side of the lower back here. Bring the feet out 10 degrees, this foot out. I'm going to pull this way. And she's solid. I seriously cannot budge her. You can sit back up there, Karen. And so, the cool part about this is, once the brain recognizes that muscle weakness and we make the correction, the brain maintains that connection, and your muscles can stay strong absent any kind of trauma like getting hit by a car accident or something like that. But otherwise it stays strong. And so when we correct your neck muscles and your jaw muscles and your lower back muscles, it's a big game changer in how well your spine holds its adjustments and how well you recover. And some people get almost instantaneous relief from this technique. Others, it takes a few sessions of working with different muscles. But again, this is Dr. Micahel Winters, Winters Wellness, Chiropractic Redefined. Be sure and subscribe to us on YouTube, like us on Facebook, and if you're local, join our private group, Sick and Tired to Fit and Fabulous. You have to search it out on Facebook, but Sick and Tired to Fit and Fabulous. and we share a lot of great health information with you there. So looking forward to helping you, and our office number is 270-554-2141. Thank you.